हेलो स्टूडेंट्स। तो आज के लेक्चर में हम पढ़ेंगे ग्रोथ चार्ट के बारे में। तो ग्रोथ चार्ट इज आल्सो नोन एज रोड टू हेल्थ चार्ट, और इसको ए पासपोर्ट टू चाइल्ड हेल्थ केयर भी कहा जाता है। सो एक्चुअली इट्स ए विजिबल डिस्प्ले ऑफ द चाइल्ड्स physical growth and development. And the first time this growth chart was designed by Dr. David Morley. Later on, this growth chart was modified by World Health Organization. नाउ द यूजेस ऑफ ग्रोथ चार्ट। एक तो ग्रोथ मॉनिटरिंग के लिए इसको यूज किया जाता है। देन फॉर आइडेंटिफाइंग द हाई रिस्क चिल्ड्रन, फॉर एग्जांपल इफ ए चाइल्ड इज सफरिंग फ्रॉम द malnutrition, by using the growth chart we can detect this problem very early before the appearance of any signs or symptoms. Other, this growth chart is used in planning and policy making by grading malnutrition, and it provides an objective basis for planning and policy making in relation to child health care at local level and the central level. Then this growth chart can be used as an educational tool to the mother. Mother can be educated regarding the care of her child by using this growth chart. And it can be used as a tool for teaching. It can be used for teaching, for example, the importance of adequate feeding and etc. यहाँ पे आप देख सकते हैं we have this growth chart that is as per WHO child growth standard. So this pink is meant for the girls and this is for the boys. Normally we use here in our setup the growth chart is that is based on weight for age. The height of the child is not taken into consideration because the weight is more sensitive measure of the growth. A child can lose weight but not height. That is very important. On each growth chart there are three printed growth curves, and these curves are known as reference lines or Z scores. The growth chart shows normal zone of weight for age in the green track, and if a child weight lies in the yellow track, that means the child is suffering from the undernutrition below 2 standard deviation, and in severely underweight zone, that's below 3 standard deviation, that is in the orange track. So direction of growth is more important as compared to the position of dots on the line. Flattening or falling of the child's weight curve signals growth failure, and it is the earliest sign of the protein energy malnutrition and may precede the clinical signs by weeks and months. The objective in child care is to keep the child in normal zone. So as you have seen in previous slides, we have two different growth chart. That light blue is meant for boys and the pink for girls. The reason is that the weight of a girl and boy of same age, they differ slightly. Therefore, we have the two different types of growth chart that we commonly used in ICDS. Weighing of children should be done with minimum clothing. That is very important to weigh appropriately. Now, on the growth chart, the direction of growth, as we discussed earlier, the direction of growth is very important. So, on the growth chart, if the direction of growth is upward, that means the child is progressing normally, and that's a good sign. And if the weight or the direction of the curve is horizontal, that means it's dangerous. You have to intervene. And if this curve is moving downward, that means it's very dangerous. You have to refer the child to a specialist for proper treatment. So that's all in today's lecture.